What is a cryptic pregnancy, and why can it happen? Samantha and her husband had been trying to start a family for years, but no matter what they did, they couldn't seem to get pregnant. They had given up hope, and they were starting to accept that they might never have children. But then something strange happened. Samantha began to feel different, as if her body was changing in ways she couldn't explain. She was tired all the time, and her clothes seemed to be getting tighter around the waist. She had always been regular, but now her periods seemed to have stopped altogether. She went to the doctor, but the tests all came back normal. There was no sign of pregnancy, and yet Samantha couldn't shake the feeling that something was happening inside her. And then, one night, her water broke, and she went into labor. It was only then that she realized she had been carrying a cryptic pregnancy all along. It was a rare and miraculous event, and Samantha knew that she had been given a second chance at motherhood. A cryptic pregnancy, also referred to as a stealth pregnancy, or a denied pregnancy, is a rare type of pregnancy in which a woman is not aware that she is pregnant until labor starts or the time comes for her to give birth. This may occur for a number of reasons, including the absence of physical symptoms, irregular periods, or the notion that pregnancy is not possible because of one's age or other circumstances. Cryptic pregnancies are relatively rare, occurring in only about 1 in every 2,500 pregnancies. However, they can be difficult to detect, and can have serious consequences for both the mother and the baby. Expectant mothers should be aware of the symptoms and signs of pregnancy and seek medical attention as soon as they suspect they may be pregnant. There are a number of reasons why a woman might not find out she is pregnant until much later in her pregnancy. These can include lack of physical symptoms. Pregnancy causes many women to experience a variety of physical symptoms, including morning sickness, fatigue, and breast changes. However, not all women experience these symptoms, and some women may have mild symptoms that are simply disregarded or attributed to other causes. Irregular periods. It can be challenging to pinpoint the exact date of conception when a woman has irregular menstrual cycles. This can make it more challenging to determine a due date accurately and to identify pregnancy symptoms. The belief that pregnancy is not possible. Some women might think that their age, health issues, or other circumstances prevent them from getting pregnant. They might not know they are pregnant until they go into labor or give birth. Psychological denial. In some cases, a woman may be aware that she is pregnant but not want to accept it. This can be due to a variety of factors, such as fear, anxiety, or a lack of support. Mental health issues. Women who are dealing with mental health problems like depression or psychosis might not be able to detect pregnancy symptoms, or may not even be aware that they are pregnant. Low levels of HCG. Low levels of HCG are frequently present in cryptic pregnancies, which can affect the menstrual cycle and conceal pregnancy symptoms. Because of this, it might be challenging for a woman to recognize that she is pregnant. Cryptic pregnancies can have severe consequences for both the mother and the baby. If a woman is unaware that she is pregnant, it's possible that she won't get the proper prenatal care, which could have serious effects on the mother's and the unborn child's health. For instance, the mother may not get the necessary medical care for ailments like diabetes or high blood pressure that could potentially harm the unborn child. In addition, the baby may not receive proper nutrition and be at risk for low birth weight or other complications. If you suspect that you may be pregnant, it is important to seek medical care as soon as possible. Your healthcare provider can help you determine whether you are pregnant and can offer the necessary support and care to ensure a healthy pregnancy and delivery. If you are not sure whether you are pregnant, it is a good idea to take a pregnancy test and speak with your healthcare provider. Early prenatal care is important for the health of both you and your baby. Thank you for your time. If you found this interesting, please consider clicking the subscribe button. If you believe we could improve in any way, we are also open to criticism.